Consultants in Department of Orthopedics in PACE hospitals. Is it? Yeah, okay, fine. Got it, sir. So, maybe we can increase the volume of the, yeah, that's fine, yeah. So, it is my honor as well as privilege to help you out in this particular disorders which are commonly seen in elderly. So I thank Colonels, our Uday Singh sir as well as other supporting staff members for giving me this opportunity to speak something related to musculoskeletal disorders. So first of all I would AC we can switch it off, yeah, we can switch it off, yeah. Shall we wait or shall I continue? आवाज बढ़ा दी? Oh, fine, right, yeah, got it. So today's discussion will be an interactive session. It won't be like I'm just going on talking and there is no feedback from your side. So I'll be asking few questions, or in general feedback from you people, like what you people are suffering with and how much you know about the musculoskeletal disorders in elderly. So today's discussion will be divided into two parts. I'll be discussing particularly about the musculoskeletal disorders, and my colleague Dr. Priya, who is physiotherapist, she will just show you few of the things which you can do it on regular basis at home itself. So can someone just or shall I do it? Yeah, please. Yeah. So this is our PACE hospital, which is located in High-Tech City, and
fans on
yeah, the next slide. The next slide, Siva, please. Yeah. There is a saying, to me old age is always 10 years older than I am. Read it again. It says, to me old age is always 10 years older than I am. So you should be prepared 10 years ahead what you might be suffering with. So today's lecture is particularly to that particular topic. Next please. I don't know whether you people are aware or not. He is the oldest individual of India. I don't know whether he is still there or not, but as per he passed away. Yeah, he passed. No, but it was the data yeah, recorded. So he mentioned it was 128. He was 128 years old. He's a Padma Bhushan awardee as well. Is it little blur? You can fine. Right. Okay, fine. So let's go with the facts little bit. Why this topic is more important in elderly people. I mean, as I mentioned first, it will be an interactive session. So I'll speak as if I'm a layman person. I hope you are understanding that. So can you just, anyone from you? Wear and tear. Lovely, good. What else?
More vulnerable.
More vulnerable in what sense, sir?
Fall injuries.
Fall injuries, good. Yes.
ligament injuries.
Ligament injuries, good, madam. Yes.
Loss of bone mass.
Yeah. Osteoporosis, good.
Arthritis.
Good. Osteoarthritis, good. Maybe you can say what you people are suffering with as well. No problem. I'll try my best. Injuries, yeah, good. So the reason of selecting this topic is the population of India is growing. The elderly population is growing. Previously, the life expectancy rate was around 60 to 65. Now, as per the latest data, it is 72 as an average age group. So, the more the life expectancy, the more the injuries to the elderly people. So it's not like I am taking this lecture only for you people. I regularly take this with the other staff as well. So this is a method through which I can or we can convey what are the precautions you people have to follow in your day-to-day activities. That's the reason I have selected this topic. Life expectancy, as mentioned, it is 72 as per the latest data. Nuclear family. Now, in a joint family, previous eras we had joint families, wherein people used to be taken care by the other people of the family members. But nowadays, since the nuclear family is more into, for that reason, these expectancy or the number of injuries, the number of osteoporosis cases, the number of fracture cases are rising in the daily doing activities. Recently, the term has been coined by Government of India. It is mentioned as super agers. Anyone has idea about it? Super agers? Super. Above 70. Those who have any comorbidities associated with 70s. So those people are called as super agers. As discussed before, the population is rising, and the more the population, the more the chances of this particular injuries. Why this condition, like whatever the musculoskeletal disorders are, late to be diagnosed by the doctors as well? Can anyone just think about it? Why the diagnosis rather is delayed in elderly age group? Just for an interactive session, क्या रीजन हो सकता है?
Symptoms come late.
Symptoms, हाँ ठीक है, बोल सकते हैं. Sometimes, yeah.
We think it's natural, and so we don't go to the doctor.
Correct, yeah. Most important, valid point, correctly pointed out. We think that this is an age process and we just delay the things. So that should not be done. That is the reason I am here, to make you people aware ki what happens as per the age group. Got it? Good. Next please, sir. So today's my topic will be based on these three common disorders. Osteoporosis. I hope you people are aware about the osteoporosis by now. I'll be going in detail in the next slides. Sarcopenia is nothing but, in layman language I can say, it is loss of muscle mass. Got it? What are the effects of these particular conditions in our day-to-day activities as well? I'll be discussing in further slides. Osteoarthritis, as ma'am mentioned. Got it. Next slide, sir. So coming to the osteoporosis, how many of you have screened yourself for osteoporosis? Can you please raise your hand?
What does it entail? Bone density?
Correct, something, either a bone density or a DEXA scan, something like that. So 2, 3, 4 bone density, good. 5 people, 6. Good. Okay, so good. I have selected this topic so that I can discuss and educate you people about the osteoporosis.
It's not available in normal diagnostic centers.
I agree. And BMD is, if you ask me what is superior as compared to DEXA scan has an upper hand as compared to the BMD.
It's not available generally.
I agree, but I think so. Maybe few of the diagnostic centers we do have DEXA scan.
Yes.
DEXA scan, sir.
Yes, center no.
Vijay has. I am sure about it. Vijay Diagnostic has. Yeah. So,
But it is not a plan for. You have to do it in the hospital.
You have to do it in the hospital.
Which hospital?
Maybe in other hospital. Here diagnostic, they are not entitled for radiation related.
no, we are shortly coming up with this particular instrument with Pace Hospital as well. We are just working on it, and maybe 6 months down the line we'll be having the DEXA scan in Pace Hospital as well. Got it. So osteoporosis, there is some basic info regarding the age and the sex. It is more common in people who are above 60 years of age group, and as compared to the male and female, in comparison, females have more prevalence of going ahead with the osteoporosis. A reason I'll explain in the further slides. Site, Few of you raised the hand, madam. For what reason did you get the BMD scan or DEXA scan? For the general checkup. Good. At least that is included. How about you, sir? We have not done, sir.
Actually, when I stayed there, somebody had sponsored it.
Acha, okay. For that reason, good. At least, yeah. Yes, madam.
I have knee pain.
Okay.
I wanted to know my bone density in 2 kids.
Oh, lovely. Good. Okay. So,
And we had a camp also in our college. Here also we had
but I think so it was BMD camp.
BMD camp.
Fine. Okay. Fine. So BMD, it's as discussed before. It has an lower hand as compared to the DEXA. DEXA is more accurate and specific, is what we say. Site. Now, madam mentioned that she had pain over the knee joint. How about you, sir? Where it was paining to you? To the hip joint? To the hip fracture? It was something like that.
It was actually nerve
Impingement.
but as a part of the investigation I had done.
Okay, great, good. So the commonest site of this particular osteoporosis is spine, lower back vertebral fractures. The moment the patient wants to stand up or shift, or the patient falls down on the buttock region, commonest fracture which is noted in people who are suffering with osteoporosis is spine related fractures. Now the reason I am discussing about the spine in detail is there is a data which has been recently published. The body structure which is at the 50 years of age group, and if you compare with the 70 years of age group, I hope you people are aware about the kyphosis. Kyphosis means forward bending of the body. So the moment any patient develops osteoporosis or osteoporosis related fractures, they are prone for going ahead with a kyphotic deformity, which is kind of a disability for individual. So commonest site of this particular osteoporosis is spine, followed by hip, wrist fractures commonly we see. Patient falls on the outstretched hand and they come with the deformity and the pain over the wrist. So these are the sites which are commonly seen in osteoporosis. Causes. Yes. Think yourself. मतलब आप ऐसे नहीं समझना आज के क्लास में कि पूरा आंसर मैं ही दूं, आप अपने तरफ से भी सोचिए.
Calcium deficiency.
Good. Calcium deficiency, yes.
False.
Okay. Fall indirectly can lead to osteoporosis because fall होने के बाद patient walk नहीं करता है, patient doesn't walk, and then it invariably goes to a vicious cycle of osteoporosis. Yes.
Poor assimilation can also be. Assimilation.
Okay.
Metabolic.
Agreed. Yeah. Yes.
Diabetes.
Diabetes. How diabetes, sir? आप बताइए अब
The
answer.
food cause of all body problems.
I agree.
Diet deficiency also.
Diet deficiency. Yeah. Yes. Calcium deficiency. Yes. Yes, madam.
Exercise inadequate.
Inadequate. Yeah. Perfect. This is. Vitamin D deficiency. Yes. Calcium and vitamin D both go side by side. Yes. As mentioned. Exercise. Yes, madam.
Generally, ladies they go on menopause.
Perfect answer.
Because may
Perfect answer.
The estrogen will not be there in the body and bones will.
Correct. Are you from medical field by any chance? No. Great. Okay. So she knows about her body, and this is the reason why it is more common in females, because madam mentioned hormonal deficiency after menopause causes more chances of osteoporosis in females. So females, yes. Genetics, yes, but doesn't have much of the role as compared to the lifestyle and dietary things. Alright. Next is disease burden. As mentioned, osteoporosis related patients who come to us is almost 30 to 40% of the individuals we see in the elderly group. So 30 to 40% of patients we see in orthopedic OPD are suffering with osteoporosis. Around 60. If you go to 70, the ratio increases to 70%. So between 60 to 70, the chances of this osteoporosis increases by more than double. So you should be careful regarding the osteoporosis thing. I'll just discuss how you can diagnose first, or how do you know whether you have osteoporosis or not. I'll come to that point. Quality of life gets affected the moment patient has osteoporosis. सर ऑस्टियोपोरोसिस आपको क्या तकलीफ हो रही थी जिसके कारण आपने टेस्ट कराया?
I had a pinched nerve.
Pinch now, okay.
That was giving me a lot of pain on my right side.
Got it. Anything else? Anyone else got osteoporosis related investigation? Fine, let me come to this. The most commonest symptom which patient presents who has osteoporosis is pain in the multiple sides. So when the bony structure gets compressed, from that particular thing we get the sensors to the brain, sensation to the brain, which gives a receptor response saying that there is something wrong in your body. So pain associated with disability is the commonest thing which the patient presents for the osteoporosis. Second is like patient is just walking, he trips and then he gets a fracture of the bone. That is also one of the indication of osteoporosis. So these are all the common things. How do you prevent osteoporosis? How do you prevent osteoporosis?
Calcium.
Okay, regular intake of the calcium. Perfect. Exercise is good. आप बोलते स्लाइड में, नेक्स्ट स्लाइड में दिखेगा सब कुछ, बट मैं चाहता हूँ कि आप लोग भी इसके बारे में थोड़ा सा सोचें. Physical activity, exercise, good. Yes, madam. Vitamin D, yes, India lies on equator zone, तो vitamin D का absorption बहुत कम है. मैंने farmers में भी vitamin D कम देखा है. Okay. Inadequate precautions pertaining to?
Careful in old age.
Correct. So diagnose it at an early stage, then we can treat it better. और सोचिए क्या हो सकता है? How do you prevent it? Lifestyle modification, good. मैं क्लू दूंगा आपको. I'll just give a clue. You people have to catch that. Okay. Any chronic disorders of the body which can lead to osteoporosis? सोचिए. Thyroid, good. Okay. Then अब थायराइड बोलते ही सब नाम आएंगे अब. मैंने दे दिया, क्लू दे ही दिया है. Yes. What happens if the patient has pain over the knee joint? Will the patient be able to go for walking, do the exercises? No. So these are all the additional conditions which can also indirectly lead to osteoporosis. I hope you are getting my point. Patient is bedridden, patient not able to go out, go for walk, cannot do the exercises due to some pain pertaining to the shoulder or the knee, can also cause osteoporosis. Treatment. सर आपको ऑस्टियोपोरोसिस दिखा था? I mean, रिपोर्ट पे आया था?
नहीं.
रिपोर्ट पे नहीं आया था? Good, lucky you. Oh, lovely, good. So osteoporosis, there is something we call it as Z scoring. So when the Z score is minus 1.5, we consider it as a level 1. When it is minus 1.5 to minus 2.5, we'll call it as level 2. And below minus 2.5, it is classically classified as osteoporosis, which has high risk of fractures with trivial trauma as well. That means just a fall or any kind of sudden jerking activity can also cause that. So next slide, please.
Is this osteoporosis symptom same as rheumatism? Can it be wrongly diagnosed or treated? What is rheumatism? How is it different?
Rheumatoid arthritis is what you are talking about. Rheumatoid arthritis is totally different topic. In osteoporosis, commonly the patient will present with multiple side pains, fatigue and all this. In rheumatoid, there are specific sites where we get it diagnosed, like small joints of the hand, knee joint is commonly involved, peripheral joints, whereas osteoporosis is more of an axial appendicular skeletal disorder. Rheumatoid arthritis is an peripheral disorder. Sir, next slide, please. So here you can see osteoporosis. As the age increases, the osteoporosis or the bone mass decreases. Common in females due to the reason which madam rightly pointed out, estrogen deficiency. Menopause. After menopause, how many of you have? If you people are okay with the personal questions, I can raise that way. Okay, let's forget about it. After menopause, it is mandatory to start with calcium and vitamin D higher dosage than compared to the normal individuals. I hope you people should be clear about this particular point, that after menopause you should be on calcium dosages, especially females. So the thing is, this particular thing, how does the age of this menopause varies. Some people get it at 45, some people get it at 50, some people get at 60. Invariable of the age, you still have to take the calcium supplementation. Next slide, please. So if you take a microscopic picture of an bone, this is what is the difference. The normal bone is dense, whereas the osteoporotic bone is porotic. That's why the name is porosis. Got it? Next slide, please. Now, sir, your point. Why it is, how it is different between rheumatoid and just osteoporosis? Osteoporosis, as I discussed, it is more of a appendicular skeleton. More. That's why hip is commonly involved, the spine is commonly involved in osteoporosis as compared to the other joints. Now, if we can see over here, this is a normal vertebrae. Here also it's a normal vertebrae. Here you can see break in the bone, secondary to osteoporosis. Compression fracture. Patient चलते चलते slip हो गया, just गिर गया है, and patient presents with pain, disability. Ultimately, when we take X-rays, MRI, CT, we diagnose this particular condition. Over the years, if you don't diagnose this and treat this osteoporosis, what happens is this particular fracture gets wedged and it causes crook deformity or kyphosis, scoliosis. All those things are commonly seen in patients who are suffering with osteoporosis. This is a normal MRI of a spine. Here you can see the disturbances. This is one of the case of the osteoporosis. This is what is anterior wedging, which I am talking about. If the patient is still not treated at this particular stage, you cannot see any vertebrae over here. It just thins out. Next slide, please. Again, the same thing. So, normal vertebrae, osteoporotic vertebrae, and osteoporotic compression fractures. Yeah, next slide, please. This is what I was discussing about the deformities. Self-explanatory slide, I don't have to discuss much about it. At the age of 50, how the lady was, and at the age of 75.
What is BCF?
Sorry?
BCF.
Vertebral compression fracture, VCF. Yeah. So 20% of the elderly die within 1 year of osteoporotic hip fractures. Out of all the fractures, this is published in 2024 around September. Out of all the fractures, any patient who is suffering with hip fracture, the life expectancy, in spite of the best to best treatment, decreases. So you should be really careful. You get wrist fractures, no problem, we'll fix it out. Even hip fracture, we fix it out. But the problem is, hip fractures will definitely decrease your life expectancy. The reason I'll come in the next slides. Next, please. This is what I am. The purpose of keeping this image is, many people have phobia regarding DEXA scan, like MRI, machine के अंदर जाना पड़ेगा. It will be difficult. And I cannot tolerate that. I get suffocation inside the MRI machine. काफी लोगों को होता है. In fact, when I went first time, even I had that phobia kind of thing. But then we got used to it. So what I'm trying to explain is, this is the investigation to diagnose osteoporosis, wherein you don't have anything related to any compression, I mean closed chamber and all. It is an open machine wherein you just lie down. It's kind of an X-ray machine only, wherein we take serial scans, and osteoporosis will be diagnosed at an early stage. I think so, yeah.
All through the body.
It depends. Now, it depends on what side pain you have and what the doctor is suspecting. I usually get spine, hip and wrist. These are the three common sides of the osteoporosis. So at one side you might have a normal bone, but the other side you will have osteoporosis changes. That's the reason two or more than two joints should be involved in osteoporosis investigation. Got it? Next slide, please. So, a normal bone goes into the osteoporosis stage. Once osteoporosis is there, 46% the fractures of the spine are seen, 16% of the hip, wrist, 16% again, and other body parts 22%. So, if you see this slide, the commonest fracture which happens in osteoporosis is spine. Fine. I'll be asking questions at the end as well. Okay. Right. Next. हाँ, this सारा लेक्चर आप भूल जाओ, कोई प्रॉब्लम नहीं, बट ये स्लाइड मत भूलना. ये पूरा अपना डिस्कशन इज रिलेटेड टू दिस स्लाइड इटसेल्फ. चलो, I want to know how many of you have converted your washroom this way. Not a single? Not everyone? किस किसी ने तो बोला है? हाँ. Okay. Grab box. Where, sir? This one?
Side on the wall.
On the wall.
It is not there.
Nothing like this. On the wall. Just look upwards there. Then take some.
Side rail. Side rail. Okay. Handle. To just go to that commode. That's it. Fine. बोलिए सर. अब ये तो सबसे इम्पोर्टेंट स्लाइड है. आप लेक्चर भूल जाओगे, बट ये स्लाइड मत भूलना. यस सर. सॉरी.
Handrails.
Okay. Good. Handrails. Yes, madam.
My father, the floor was made in shade of floor. So, on
Most
the-
important point. आप
And the side handle or walking into the bathroom.
lovely. Good. So the moment, yeah. Correct. Yes. Good point. So these are the mandatory things which you people should do at home. I'm telling you, you will reduce the chances of fracture more than 50%.
Anti-skid tile.
Yeah, what do we say? Yes.
Sorry.
I would say same thing.
Yeah. Anti-skid. Yes. Some things पूरे एक जगह पे नहीं ला पाया. मैं पूछ रहा था आपसे, आपने बोल दिया. ठीक है, right? Fine. Okay. No, sir. Just go back. No, I want to spend some time on this slide because this is most important thing. May I know the reason of this particular thing? Just थोड़ा सा सोच के बोलिए. I hope everyone is okay. मैं थोड़ा सा खींच रहा हूँ टॉपिक को.
It's an effort to get up.
Correct? Fine. Why do you want support to get up, sir? Knee pain, good. Knee pain, good. Back pain, good.
Losing balance.
Losing balance, very good. Good. तो अभी आप इतने सारे आंसर खुद से दे रहे हो, तो घर पे चेंजेस करने पड़ेंगे फिर. हाँ.
अभी तक जरूरत नहीं पड़ा.
Eventually, sir, definitely you will have to. Any more? किसी का? Madam, there is one patient of mine who has underwent knee replacement. She is here. I called her. Madam, आपको भी ये चीज घर पे करना पड़ा था? Yes, तो बोलिए ना. Yes, right. So after knee replacement, to decrease the pressure on this particular knee, we need to give this kind of support. Fine. Anti-skid flooring, most important thing. Proper lighting. One more thing out of this particular box, I want to just make you people aware. That's what, yeah. Floor should be taken care. Most important out of the box thing which I want you people to make be aware about the point. How many of you have heard or experienced that the moment you pass urine, you get giddiness? Giddiness, or you feel dizziness, or you fell down. How many of you? नहीं, कोई शर्माने वाली बात नहीं है, बोलिए. देखिए सर, ये भी हमारे पेशेंट है. यस, आपने भी बोला है. Good. For what reason? Did you think why it happens?
The moment I said something is wrong, something I cracked.
Okay.
And after some time I realized that I'm okay.
But did you ever think कि why after passing urination you are getting that giddiness?
So that I
You should think about it. The moment you pass urine, your vasovagal reflex gets activated and you particularly try to fall down. That means there is fall in the blood pressure. Sudden fall in the blood pressure makes the patient feel dizzy, and most of the fractures happen at that particular point. They feel dizzy and they fall down.
Let's say again.
Sorry? Okay, so the moment you pass urine, the blood pressure in people who have something to do with the urinary bladder kind of thing. Like urinary incontinence is one of the things which is common in elderly people. So those people will have fall in the blood pressure and they will feel giddy and high chances of getting fractures due to that particular fall if the patient is already suffering with osteoporosis. Got my point? Second, one more point out of the box I want to discuss. How many of you have heard that the patient went to bathroom and the patient or the person passed away? Good, good. अभी हाथ उठ रहा है. Good. मैडम कभी सोचा क्या रीजन हो सकता है? Good, stroke. Yes, sir.
Attend to them, they go fall and then
Good. So what you should do, sir? So what modification you should do in this particular thing? Button. Good. You should have an emergency bell. Emergency bell should be there in the washroom as well. Anything else? Don't lock the door. Perfect. Yes. Good. हाँ. शुगर लेवल डाउन हो रहा है तो सबको चाय दी जाए.
do they have to keep some things in the washroom, like glucose or something?
Good. Yeah. Yes. मैडम ने कैच किया पॉइंट. ओके. हाँ. Sugar things something if those people who have. Yeah. Anything else? Have you heard that the patient passed away in the bathroom due to heart attack?
Yes.
Yes, तो यही सुनना चाह रहा था मैं आपसे. आउट ऑफ द बॉक्स डिस्कशन है. Why? Because defecation, passing motions, or sudden passing urine can definitely increase the chances of myocardial infarction. That means MI. ये भी चीज आपको ध्यान में रखनी चाहिए घर पे. That's the reason people say if you go to 5-star hotels and all, they have an emergency bell over there. For that reason only. Ki anything is emergency, please press that bell. Sir, next slide. I hope. Any more discussions on this slide?
Yes.
Yeah, please. Yeah, go ahead, sir. Yeah.
You are in a situation, you are in the bathroom.
Yeah.
And you are having a heart condition or whatever.
Correct.
Would you be able to use that emergency bell?
It depends on how massive the cardiac attack is. But still, nothing is better than having precautions. Yeah, you should.
Conscious, you should be able to.
Correct. Yes. Yeah. Yes. Correct. And elderly people who have osteoporosis or who is suffering with any kind of fracture, stroke, who has repeated tendency of falling down, they should never be sent alone for passing, to the washroom activities. Remember this. This is most important. मेरे पास कई patients आए हैं, हमने बहुत लोगों को अपडेट किया है. सिर्फ रीजन यही था कि इनको मोशंस का सेंसेशन आया या यूरिन का सेंसेशन आया, ये अकेले चले गए, गिर गए वॉशरूम. And then I had to operate on them. As I mentioned, hip fractures का life expectancy patient का कम हो जाता है. It decreases as particularly to the hip fracture. So please make a point कि you need to modify your washroom this way. Next slide, please. Yeah.
Why passing of urine or motion once, you should get a
Fall in the BP?
BP is one.
Yeah.
If there is no BP problem,
No, it's not related to that, sir. Suddenly the BP falls because urinary incontinence patients के अंदर they are not able to control the motion, the urine passing things.
it can cause a
Yes. We have seen many patients falling down. Sir,
What are one middle?
that is also L guard, sir. Just to get up in a better way.
Next to the WC.
This one you're talking?
Hey, this one, where
I didn't get your point. Sorry.
middle one at the bottom.
Yeah.
Where exactly is here?
Near the commode only. More. Yeah, near the commode. Yeah.
Doctor,
Yeah.
one more issue, which is very, I don't know if related or not. If you have a sharp temperature difference is there, that also can cause some strokes.
Vasovagal that can cause vasovagal attacks, sir. But for less likely though, but yes, possibility is there. Less likely. Maybe a physician can.
Yes, brain strokes also will happen.
Madam, those. I see. I'll discuss what I know. The thing which I am not aware, I will not comment about it.
What I was told is temperature difference. In case you take a cold shower,
Good valid point. I'll come back to you on this point. I'll just discuss about this. Definitely, anti-skid, anything. So you should not have a flourished kind of thing. हाँ, yeah, smooth वाला नहीं चाहिए. थोड़ा सा उसका. No, sometimes they tend to fall because of that. Your toes get stuck in that and it falls. So that is not advisable. As such, not advisable. But temporary, you can manage that way. Next slide, please. So this is what is osteoporosis prevention. As everyone mentioned, exercise regularly, take calcium supplementation. I hope you people are aware. How many of you are taking calcium supplementation? 1, 2, 3, 4. That's it. 5, 6, 7. That's it.
is there some you take for some time and then leave a gap again? Take it.
And now there are 2 points in this, sir. If you are suffering with any heart-related disorders, ideally we avoid giving excess calcium. If anyone is suffering with just osteoporosis or some kind of bony pain, we do give calcium. The minimum dosage which is recommended is around 1200 mg of calcium per day.
Continuously, without a gap.
What I follow, I'll discuss about it. I usually give it for around 2.5 to 3 months. I give a pause and start again as per the levels of the calcium.
How much loss?
It depends on the levels. I get it checked. I get it checked and then based on that I decide. If patient is suffering with osteoporosis, there is absolutely a different line. Just not calcium will help. You'll have to give a combination or combo therapy of calcium, vitamin D as well as bisphosphonates. I hope some doctors are also here where there I could see 1200. Remember this, madam. 1200 milligrams of calcium. Yeah, per day it is.
Which type of calcium, like calcium carbonate, or there is another type of?
So in pregnancy we don't give calcium carbonate, madam. This usually we follow. Rest all individuals can take the citrate one. Yeah. So calcium supplementation, magnesium. How does magnesium help? People take multivitamins लेते रहते हैं सालों साल, but उनको पता नहीं है क्यों लेते हैं. Magnesium, how does it help? No, okay, something else. I'm expecting something else. Magnesium. इतना बहुत. Correct, perfect. आप तो medical field से नहीं हो ना? Physiotherapist, हाँ, तो answers are बरोबर. Good. Our physiotherapist can also answer then. Okay, fine. So magnesium deficiency can cause muscle cramps. तो किसी को भी अगर मसल क्रैम्प्स रिपीटेडली होते हैं तो बेस्ट थिंग टू डू इज टेस्ट योरसेल्फ फॉर मैग्नीशियम और इनवेरिएबली स्टार्ट मैग्नीशियम थेरेपी. नो प्रॉब्लम. हाँ, या
can start this without consultation. Calcium.
मल्टीविटामिन तो लेते ही है ना सर लोग.
Calcium is very.
कैल्शियम दैट्स व्हाट, इफ देयर इज नो हार्ट डिजीज यू कैन स्टार्ट. हार्ट डिजीज अगर है तो एक बार कार्डियोलॉजिस्ट से कंसल्टेशन करके लेना चाहिए. या अनलेस फॉर कार्डियोलॉजी फॉर.
Also, if you have cramps, you can take.
But see, again, there are many other causes of cramps as well, like sodium potassium imbalance can also cause cramps. In general, I am talking this particular thing, sir. Yes, sir.
Hypertensive patients are also taking some.
No, magnesium increases. Magnesium and sodium increases the blood pressure. Yeah, calcium, no, sir. I am not talking calcium.
Hypertensive patient taking calcium supplement.
Provided they are not having cardiac underlying cause or renal underlying cause. Renal means kidney related. Yeah.
If we take more calcium, is it true or is it a fact that kidneys will have stone or gallbladder?
Hypothetical thing, madam. It all depends on the place from where you belong to as well. If there is some disorders are related to the certain areas, those people who have. I'll ask for it. Thank you. Give it to me. No problem. दे दीजिए. No problem. Thank you. Yeah, I'll keep it here. So if you belong to certain eastern group, eastern area and all, where the chances of this particular kidney stones, renal stone, gallbladder stones are high, in those individuals we are cautious giving calcium supplementation. Yes. Yes. Northeast kind of thing. Yeah.
What is the reason?
I mean, they have that genetic tendency, sir. Yeah, next slide, please. So, no, just a minute, sir. Just a minute. Please go back. So, just doing regular exercises or taking calcium, magnesium, vitamin D will not help. It is a combination therapy, is what I am discussing. Smoking is one of the, I mean, it's like uh, most important thing which you need to avoid. Yeah, stop, or as far as possible avoid smoking and drinking. It is like an enemy for the bone. So you need to, अच्छा सर अब ये क्या करोगे सर? अब तो जो है लिखा हुआ उन्हें डिस्कस करना ही पड़ेगा मुझे. No, smoking as well. Yes, smoking has high chances of osteoporosis. Drinking as well, sir. Yes, definitely. Yes. You are more particular about that.
Moderation, it's okay.
अच्छा सर, वो तो लिखा हुआ है कि मॉडरेशन में कोई दिक्कत नहीं करेगा, बट स्टिल ऑस्टियोपोरोसिस अगर है तो अवॉइड करिए.
Smoking.
Yes, definitely.
And
Yes.
drinking also.
Yes. If you want me to repeat 10 times, I'll do that. Yeah. Huh.
So how do you think you're finding out blood tests? So is there a recommended periodicity for carrying out blood tests?
Sir, in that case, if you ask me, I'll suggest above 45 yearly once master health checkup, which I follow for my known people and my parents. Yearly once checkup is required above 45. चाहे आपको कुछ प्रॉब्लम हो या ना हो, आप 5-6 हज़ार रुपए का एक ब्लड टेस्ट का पैकेज ले लो. बहुत सारे ऑनलाइन लैब्स है जहाँ से आप करा सकते हो. आई एम नॉट प्रमोटिंग पेस हॉस्पिटल इन दिस. लेट मी बी क्लियर. You can just go ahead and take the any lab. 5,000 to 7,000 rupees में अच्छा पैकेज, 130, 140.
We have a panel hospital there too.
Oh, lovely. Good. Done, sir. Thyroid. Yes, sir.
Long-term efficiency or levels of B12 have any relation?
You just take the referral.
B12 in combination with vitamin D deficiency definitely has body pains or tingling sensation, sir. Timiri sensation बोलते हैं ना, that have. That is expected with vitamin B12 deficiency more as compared to D and calcium.
Doctor will almost for cramps, na?
Yeah.
Is it because of vitamin B12 the best है ना sir package?
Some patients have vitamin B12 deficiency, some patients have magnesium deficiency. That's the reason I asked you should consult the doctor and take it. But multivitamin, make sure whichever multivitamin you take, magnesium should be included in that, so that you don't miss that particular magnesium. Zinc and all is all related to this Bicosals and those ulcers and all related things, sir. हाँ, next, yes. थोड़ा टॉपिक से बाहर आ गए थे, बट आंसर देना पड़ा मुझे. Second topic of today is sarcopenia. Now, whatever I am discussing, those 3 topics are interconnected with each other. That's the reason I took these topics. Any idea what is sarcopenia? Please, ये मत देखिए. हाँ, muscle loss, good. सिर्फ muscle loss, muscle weakness, muscle loss, weight loss, good. Okay. Anything else? सबसे इम्पोर्टेंट क्या होगा? मसल लॉस होगा तो क्या होगा? क्या नहीं कर पाओगे आप? करेक्ट, मूवमेंट नहीं कर पाओगे, एक्सरसाइज नहीं कर पाओगे. यस, नेक्स्ट. इवन आवर वेंकटेश इज लर्निंग समथिंग टुडे. सॉरी, ग्रिप विल बी अफेक्टेड. गुड. ग्रिप गुड. सोचते रहिए. हमारे MBBS में एक प्रोफेसर थे, उनसे मैंने सीखा है कि इट शुड बी एन इंटरेक्टिव सेशन. दैट्स व्हाई आई ट्राई माई बेस्ट टू बी इंटरेक्टिव मोर, क्योंकि इंटरेक्टिव सेशन से ही आपको मेमोरी वो याद रहेगा. या रिटेन. यस. Yes, please continue. What happens if there is muscle posture? Yes, good. Strength, yes, good. Mobility will come down. Yes, mobility comes, decreases. आप वहाँ क्यों बैठे हो सर? इधर आ जाइए. सुनाई दे रहा है इसलिए वहाँ बैठे हो, ठीक है, कोई बात नहीं.
Osteoporosis can lead to sarcopenia.
इनडायरेक्टली क्या होगा सोचिए. अब आपने क्वेश्चन पूछा है सर, आंसर दीजिए.
Because bones and muscles are together.
हाँ, यस, परफेक्ट. यस. तो क्या होगा? ऑस्टियोपोरोसिस होगा तो पेशेंट को पेन होगा, वॉक नहीं करेगा तो मसल वीक हो जाएगा. That is what is sarcopenia. So sarcopenia is just not muscle loss. It is strength weakness as well. Strength, muscle loss होने की वजह से strength भी weak होगा, and that is why it is a deadly combination. So as you can see here, sarcopenia ये माइक्रोस्कोपिक इमेजेस है, हार्मोन इम्बैलेंस की वजह से या फिर कोई इन्फ्लेमेशन या many causes are there of sarcopenia. The muscle mass decreases, the muscle strength decreases, and it definitely affects the quality of the life. Next slide, please. Yeah.
Some terms which
Yeah.
you are not familiar with, can explain what atrophied and
Sir, if you want me to go in that depth, then it will take really long. I mean, those are all medical terms, which I think so.
sir, we are aware what the symptoms which
Next slide, I'll explain, sir. Yeah, sir. So self-explanatory thing, but still I'll try my best. Again, this is a medical slide, precisely. So, what happens when there is anything to do with the osteopenia? Osteopenia is the early stage of osteoporosis. So, osteopenia में अगर bone fracture होता है, bone fracture होने के chances होते हैं. Then reduced physical activity is one of the symptoms which can lead to sarcopenia. Type 2, this is what this particular thing you just focus. Insulin resistance. So what happens in diabetic patients? Diabetic patients, we ask the diabetic patients to जाओ walk करो ताकि आपका शुगर का डोसेज है वो कम हो जाएगा. Right? We ask patients to go for more of the walking and all. I'll do it. Then, yeah, that's what I was asking in the beginning. So we ask patients to go for walk. Diabetic patients को walk करो, exercise करो. But patient को pain है, patient बाहर नहीं जा पा रहा है घर के, तो कैसे? So type 2 diabetes mellitus के अंदर sarcopenia भी commonly see. Though type 2 diabetic people are little heavier on the sides, but still they don't have the muscle mass. There is more of the fat accumulation which can lead to this. Nutritional deficiency can also cause sarcopenia if there is no proper nutrition. Like, what is the most important thing required for the muscle? Good. So protein supplementation is must for people. I'm not discussing anything related to the additional supplements. हाँ, जो भी natural resources है, I prefer that. Next slide, please.
Cause dementia?
Sarcopenia, your quality of life decreases, sir, and then all those vicious cycle sets in. So dementia is a separate topic. If you want me to discuss all those things in detail, I will come back with that slide presentation as well. Yeah, next. So the normal muscle which pulls our elbow is something like that, and atrophied muscle, it is thinned out. You can see over there. So in exercises as well, there are particular sets of exercises which our physiotherapist will deal with. So there is something we call it as flexibility, जिसमें हम सिर्फ movements करते रहेंगे. There is something we call it as strength training. Strength training में क्या होगा कि muscle का mass maintain रहेगा. You want me to little push the slides, sir? I hope you are okay. Perfect, right? Yeah. So you need to go ahead with the strength training. There is particular scale through which we follow in orthopedic department. First is range of movements. कुछ patients का range of movements होता ही नहीं है, हाथ यहीं तक उठता ही नहीं है ऊपर. तो पहले range बढ़ाओ, उसके बाद में go for strength training. Then the next level is endurance exercises. That is again one set of different level, but I will not go in depth because elderly group it is very difficult to do that endurance level exercises. Next slide, please. Next slide, please. This is medical slide. Yeah. Self-explanatory, आप पढ़ लीजिए. Impacts of sarcopenia, I'll read out. Breathing problems. Muscle loss can cause breathing difficulty. Definitely, when the muscles of the chest region are lost, you don't have that capacity to take the breathe in and breathe out. So it will cause breathing problems. Obesity, yes. Why obesity? Because आप चल नहीं पा रहे हो, फिर नहीं पा रहे हो, तो obesity increase होता है. Insulin resistance, same thing. Increased risk of infection because you are not doing your regular activities properly. Depression, yes. Heart problems, increased mortality due to loss of muscle mass, increased risk of pressure ulcers because there is nothing to support your bones. Muscle loss होगा, fat loss होगा, definitely the pressure will be carried to the bone. That's why ulcers is what it is mentioned. Reduced mobility and increased risk of fall. Loss of muscle mass reduces strength and increases risk of falls and fractures. Next slide, please. Next slide, please. This is okay. So, how do you prevent sarcopenia? How do you prevent? Just to brief.
Strength training.
Strength training, good. Okay, protein intake, good. Or
Calcium.
calcium doesn't have much role in sarcopenia. Indirectly, it does, but direct causes, direct treatment things I am discussing.
Exercise.
Gymming.
Exercise, gymming, good. Strength training. Good. या हाँ हाँ नहीं ठीक है कुछ ना कुछ एक्टिविटी करते रहिए सर बस दैट्स इट
So, doctor, maybe I don't know what about walking? Somebody says too much of walking is not good. I've walked 70, somebody says walk sometimes. What is the
good question
after 70?
way difficult to answer your question without understanding the patient disorders. In general, I'll say, in general, a doctor who says don't go for walk is not a doctor. I say that way to my patients, and I feel so that yes, I'm partly correct in that. Because जब आपका walking stop हो जाएगा ना, समझ लो कि आपको बेड बुला रहा है. You should go for walk regular basis. Steps and all, आजकल वो स्मार्ट वॉच एंड होता है, that is all secondary. आप बाहर तो निकलो पहले. This is what is next topic, sir. Osteoarthritis. So these two topics are basically focused for people in general, but osteoarthritis topic is specific for people who have knee joint pain. I'll just discuss about it. So as the age increases, our baldness increases, hair texture changes, hair color changes. Likewise, there is something we call it as articular cartilage in the knee joint, or any joint particularly, decreases as the age increases. So what is osteoarthritis? It is nothing but wear and tear of the major joints of the body, particularly hip, our shoulder, as well as knee. Commonly involved is the knee joint. So there is a data which has recently published. People who are more into this like army as well as more into the sports, not doing the proper training exercises, are landing up into the osteoarthritis. In your younger age group, you used to carry the weights, all those jumps and all activities. So people nowadays are coming back to us with this osteoarthritis or pain over the knee joint symptoms. Site commonly involved is knee joint. Ratio as compared to the men and female, females are more prone for osteoarthritis. Causes of osteoarthritis again are divided into two types. One is primary and secondary. Primary is related to age. Secondary is related to any kind of fractures which has been noticed in this particular lower limb. जैसे कि ankle fracture हो गया, तो alignment change हो जाएगा body का, and then patient will walk on that particular mal-aligned position and will cause wear and tear of the knee joint. So those are all the secondary causes. और कोई surgery हुई है जिसमें हड्डी टूट गई है घुटने की and we have operated, that is one of the reason for the secondary arthritis. But if you ask me which is more common, primary is more common as compared to the secondary. Signs, most of you people know, signs is patient will in the initial stages will come difficulty in getting up from sitting position. That is the commonest sign which patients present to us. Second is some abnormal sound inside the knee joint. We call it as crepitus in our way, but there is some grinding sensation the moment patient folds or extends the knee joint. Third, patient will have difficulty in sitting on the floor. Fourth, difficulty in climbing the stairs. Stairs climb करते हो उनको difficulty होगी. Fifth, they will not be able to use the Indian toilet. These are all the common symptoms which patients presents to us. So if anyone is suffering with such kind of symptoms, go to the doctor. get an X-ray done, get the grade of the osteoarthritis, and start treatment as early as possible. Diagnosis, as I discussed, commonly we do basic is there is nothing best than human touch. That's the reason orthopedics is not well flourished or more famous in this online consultations and all, because in other branches and all आप symptom बोलो, blood test लिख देंगे और आपको report आ जाएगा and treatment will be started. But in orthopedics your hand works more than the investigation, at least for me. I examine and then if required investigate, and based on the investigation I start up the treatment. I classify the stage of the osteoarthritis. There are 4 stages precisely. I have got the normal knee thing. I think so. I have got the normal one. Yeah. So this is. Can someone hold this to me? For me, yeah. So the top one is the femur bone or the thigh bone. The below one is the leg bone. Now you can see there is something white color thing over here. That thing we call it as articular cartilage. This articular cartilage decreases. The thickness of this is around 5 to 7 mm in a young person. It decreases to the extent that it is no more available or visible rather in elderly age group. So I might have one more thing. No, not now. Okay. So you should ask me, doctor, why it is only at this particular point? Why it is not over here? Common thing, huh? Friction, correct. It prevents friction. Yeah. So it prevents it from grinding sensation. Articular cartilage is like a cushion kind of thing. And the blood supply of this, remember this, why we say कि osteoarthritis is not reversible. I'm just discussing in depth about it ताकि आपको कोई अगर डॉक्टर बोले anything, आपको अगर डॉक्टर बोले कि ऑस्टियोआर्थराइटिस हो गया है और आपको नी रिप्लेसमेंट करना है, क्यों बोलते हैं डॉक्टर? व्हाई दे से? आई एम जस्ट ट्राइंग टू एक्सप्लेन इन अ बेसिक वे. दिस पर्टिकुलर आर्टिकुलर कार्टिलेज डजंट हैव अ ब्लड सप्लाई. आप यहाँ कट करो खून निकलेगा, आप यहाँ कट करो आपको खून नहीं निकलेगा. आप जब तक ये 7 mm डीप नहीं जाओगे तब तक आपको खून नजर नहीं आएगा. The blood supply of this particular articular cartilage is through the fluid which is present around the knee joint. I hope you are getting my point. So the fluid, synovial fluid we call it as, which gives nutrition to this particular articular cartilage. So as age increases, this cartilage thins out, and there is nothing till date. There are few studies going on, research going on, but till date it is not successful. Stem cell therapy hai, all those things are going on, but to be frank, whatever works in the patient we advise as well as treat. So this particular articular cartilage wear and tear happens. Mr. Venkatesh, can you see in my bag there is one more of this, so that no, this is what we do, knee replacement thing. So osteoarthritis, there are 4 stages. In grade 1, patient will just come with difficulty of all these things at a minor level. Stage 2, patient will have little higher pain. Stage 3, patient will come with kind of deformities as well. So this is what happens. This is kind of grade 1. You can see this is exposed bone actually. Once the bone is exposed, there is nothing which a doctor can do. That's why some doctors suggest giving injections inside the knee joint. Why do they suggest? Why do they take the X-ray and then suggest you to go ahead with the injections? Reason is this: if it is grade 1 and 2, still injection has some benefits, but not a permanent solution for sure. But if it is grade 3 and 4, I don't know whether people are following that or not, but ideally it should not be given.
What is the injection?
I'll come. So yes, madam. I'll come in the treatment part, madam. I'm still one step behind that. So pertaining to the fluid which I discussed, we call it a synovial fluid. The synovial fluid has something inside the component of the synovial fluid is hyaluronic acid. which doesn't allow healing of that articular cartilage. So, for example, if we get a cut, it heals automatically. But articular cartilage doesn't heal once the damage is done, because there is a content called as hyaluronic acid in that synovial fluid which doesn't allow the healing of that particular cartilage. That's why we need to either supplement with an hyaluronic acid little bit so that the viscosity, that means the friction kind of thing, is maintained. Coming to your points, there are two injections which are commonly given. One is a steroid, which I don't recommend unless and until patient has some like comorbidities, or patient is not fit for surgery, or financial status of the patient considering that, because hyaluronic acid PRP injections are way costly as compared to the steroid injection. Steroid is like धनुष्यबाण, आप मार दो चल गया तो चल गया, और उसका परमानेंट क्योर नहीं है. Neither of the injection will have a permanent cure. So injection depends on the stage of the disease. Remember this. अगर कोई 50, 55, 60 के आसपास जा रहा है, invariably it will be a grade 3 arthritis. If it is a grade 2, still we try giving a hyaluronic acid injection or a PRP injection. Recently, day before yesterday, I gave one of the patient hyaluronic acid with PRP combination both together. The name is Monoshot. Recently launched around 3 months ago or so. So we have given to one of the patient. I am yet to see the results of that. But PRP has wonders as compared to steroids. Steroid definitely patient will praise. जहाँ पे भी जाएगा बोलेगा कि यस डॉक्टर ने मेरे को मेरा पेन ठीक कर दिया, बट इट इज टेम्पररी. उस दौरान, उस 10 दिन, 1 महीने, 6 महीने के दौरान जिसको भी मिलेगा वो सबको बोलेगा कि ये डॉक्टर के पास जाओ, वो इंजेक्शन दिया ठीक हो गया. 6 महीने के बाद उनसे पूछना है कि क्या हुआ है. This is what
I just want to tell.
Yeah.
My personal experience, my wife had knee pain, severe knee pain. I think she was 55, but 8 to 9 taking back. Now, till now, she doesn't have knee pain after taking some high-ground injection.
That's what I'm saying, sir.
It's pretty better, almost 8 to 10 years.
I'm not talking about hyaluronic acid. I was talking about steroids. I was talking about steroid. Hyaluronic acid, yes. If at all it works, it does wonders. I agree. Again, agreed. So there are many other causes of knee joint pains. It not necessarily it should be osteoarthritis related. It could be rheumatoid arthritis. It could be a condyle surface lesion. Could be meniscus tear. Many causes of knee pain would be there.
Talk about the age, if I age or something else.
Age related thing, yeah.
What about glucosamine? What does it do?
Again, it has, see, if patient is not ready for going ahead with the injection therapy, we try to give glucosamine chondroitin sulfate. But till date, to be frank, it doesn't work in grade 3 and 4. Early stage of arthritis, definitely it has effect, but not in grade 3 and 4. Grade 3 and 4, I don't give chondroitin sulfate. Sir, the content, glucosamine chondroitin and all is one of the content of the articular cartilage. So we try to develop that by artificially injecting or giving the supplements.
Again, it is an injection.
I mean, hyaluronic acid is an injection, yes. Chondroitin sulfate is a component of this particular. We take the tablets and there are research. See, कुछ ना देने से अच्छा कुछ दे के patient को, there is something we call it as placebo therapy also. In some patients we do that. जिनको हाँ दवाई खाने से मेरे को ठीक लगता है सर, उनको हम ये tablets psychological kind of thing देते हैं.
Stage 3 and stage 4, what is the quantification? Stage 1 and 2.
I didn't get stage 3 and 4.
Stage 1, 2, 3, 4 बोला था.
1 and 2 I usually give medications and injections. Stage 3 and 4 I try to avoid giving that.
I'm talking what are the symptoms for stage 2, 3, 4 and 4.
Variable, sir. It all depends on your muscle strength. It all depends whether it is rheumatoid arthritis associated with osteoarthritis or not. In general, I'll say stage 1 and 2 के अंदर patient will come with mild symptoms, but stage 3 and 4 में severe symptoms आएगा. Croup deformity as well.
1 and 2 you give injection, so 3 and 4 is replacement.
3 I try to manage them with physical therapies, combination cocktail therapy we call it. Stage 4 में तो knee replacement. She is there. I'll be showing few videos as well.
What is the preventive diagnosis for this?
Prevention of this osteoarthritis, I am coming to that point.
Whether you are not aware.
How do you know whether you are suffering with osteoarthritis is what you want to ask? Simple, sir. When you are able to do your regular activities without pain, that means you are doing good. There is no sound associated with pain, that means you have cracking sound or whatever it is. We call it as crepitus.
Like around you said you sit down for some time, 15-20 minutes.
I didn't say that.
Just normal getting up.
Normal.
Like you are sitting now on chair. When you try to get up, if it is not pleasing, you should screen for that. Not necessarily that कि आपको नहीं है ऐसे नहीं consider करना है. Early stage पे diagnose करो और treat करो. Like I mentioned, stage 1 and 2 you need to give the supplements and do exercises. I think so. Dr. Priya will discuss more about osteoarthritis related exercises. In elderly age group, I assume that it is already stage 2, something like that. Stage 1 is something which we see in the around 30s, 40s, 45, something like that.
Screening as doctor.
Sorry? Staging of the osteoarthritis after an X-ray, not on clinical presentation. We decide based on X-rays. I think so. I have one slide on that. Yes, madam.
I just how else to test other than X-ray?
There are a number of tests, madam. Like we do MRI as well, we do CT as well. But X-ray gives standing X-ray. Again in X-ray, it shouldn't be an X-ray in lying down position. It should be a standing X-ray. Standing X-ray, weight-bearing X-ray will give you how much the cartilage depth it is. Next slide, please. These are the stages of osteoarthritis. Self-explanatory. I don't have to mention anything. In stage 1 के अंदर, I mean doubtful. Patient might have, might not have, but still we advise prevention therapies, treatment therapies. Stage 4, the subchondral bone is exposed and the nerve endings of that subchondral bone gives sensation to the brain that yes, there is something wrong. Next slide, please. Yeah, if you, the reason of this particular slide is if you diagnose or prevent osteoarthritis, you can enjoy your life. Next slide, please. So, I'll just go out of the box again. We'll take 2 minutes of this particular thing. I was not aiming to be an orthopedician or clinical doctor. I was aiming for an preventive and social medicine doctor. But due to some reasons, I couldn't join that. I joined the clinical thing because I feel proud that there are 14 doctors in my family. So in all over India, if we take our caste, ours is number 1, where we have around 14 doctors in the family. That was the reason I was asked to select for the clinical field as compared to the preventive and social medicine. But still, if anyone gives me an option still, I would like to be a doctor who tries to teach and guide them before the disease sets in. That is what is preventive and social medicine. So this slide is for that. Patient education and lifestyle modification is the most important thing which we need to follow. Second is rehabilitation, that means exercises and all. Mechanical intervention with the help of physiotherapy again. Complementary and alternative therapy, like there are something we call it as kinesiotaping, which doctor will discuss. Pain relievers on and off you can take. I suggest whenever you have pain, prefer Dolo over any other tablet. Dolo 650, if you don't have liver problem, safely you can take Dolo. If you have liver related issue, CKD, that means chronic kidney disease bolo, या फिर liver cirrhosis bolo, Ultracet is the safest tablet which I usually prescribe to my patients. Intra-articular injections, we had a discussion on that. Needle lavage used to do, but now there is no rule of that. Surgical intervention I discuss in next slide. So this is your point, sir. Osteoarthritis and rheumatoid arthritis. Osteoarthritis is specific to one particular joint or 1 or 2 joints. Rheumatoid, you will have multiple joints involvement. So the commonest joint which is involved in rheumatoid is hand. Fingers, yeah. Fingers, we call it as proximal interphalangeal joints or small joints. याद रखना है, small joint rheumatoid arthritis, large joints osteoarthritis. Good. Next slide.
Rheumatoid arthritis is not treated by ortho.
If a patient comes to me, I'll send it to rheumatologist. If a patient comes to me, I'll send to rheumatologist. But if rheumatologist is not available, I'll treat and ask that patient to meet rheumatologist. Next. Yeah. Treatment of osteoarthritis, as discussed, strength training, weight management. Weight also has definitely an upper hand in osteoarthritis. So that's the reason we ask patients to walk, घूमो इधर उधर. But pain है तो कैसे जाएंगे? So that's why you have to prevent it or treat it at the right stage. Education, aerobic exercises are the best in this. Aquatic exercise is the best. If you ask me at your age group which is the best exercise, I'll say swimming. Cycling, there are again two thoughts in this, sir. If you give me an option of cycling, treadmill and cross trainer, I'll prefer cross trainer as compared to cycling and treadmill. Treadmill, definitely no. Treadmill causes more wear and tear of the knee joint. Cycling, yes, I agree, it is good, but again it is a friction thing, sir. In cross trainer, what happens is there is no much load on the knee and your hand also moves simultaneously. So I hope everyone knows cross trainer, in which your hand also moves as well as leg also moves.
What about nutrition in this? Any nutrition aspect?
Vitamin D, calcium, all those things, you just strengthen the bone, that's it. Next slide, please. This is related to the surgery. Now, people are scared about the surgery. They think कि मैं चल नहीं पाऊंगा, or there might be some blockage in the vessels or some paralysis attack, which used to happen before who were not experienced in this particular field. Nowadays, each and everyone is experienced. So, yeah. So, benefits of knee replacement is patient can walk without any support and in a normal way. Pain out of this knee replacement, we don't say 100% pain will subside. 70 to 80% pain subsides, but it will be definitely better than what the patient was before. Of course, there are few ifs and buts. If you operate around 500 cases, around 1 or 2% patients will have this recurrence of the pain and all those things. That is expected. But if you take with the majority, patients are happy with this knee replacement surgery. You should ask me what all you can do after knee replacement. What all you can do after knee replacement? Or rather, what you cannot do after knee replacement. You cannot squat, you cannot sit on the floor, you cannot use Indian toilet, you cannot fold your knee joint more than 90 to 110 degrees. These are all the drawbacks of knee replacement, but given comparison of the benefits and demerits, definitely benefit has an upper hand. So painless mobility in most cases, that's why it is written most cases. Better walking ability in most. Correction of the deformity, I have operated on patients who are literally walking like this. Why that happens? If you have seen that particular model, the articular cartilage is on both the sides. But inner side of the knee joint, wear and tear of the cartilage on the inner side of the knee joint is commonly seen. Inner side of the knee joint is somewhere over here. So when this particular cartilage wear and tear happens on the inner side, definitely they will have this kind of deformity, which we call it as genu-varus deformity in our medical terms. So the moment genu-varus deformity is there, patient will definitely be bedridden most of the time, or they will be restricted to the limited lifestyle things. They'll refrain themselves from going out of the particular house. So better correction of the deformity we can do with the knee replacement, better range of motion of the knee. Some people I have operated, they were not able to bend the knee joint beyond this 30 degrees maximum bending activity. We have increased to 90 degrees. One more thing is those who are diabetics, they can go for walking, painless walking. They don't need any painkillers, less chances of any kidney diseases in the future. Better social life, they can meet people around, they can go social gatherings, they can less social isolation. Next slide, please. This is what we have done in the base hospital, some of the images. Now pertaining to the implant, this slide I have kept it just to make you aware and what ECHS approves. I don't want to debate on that. I am just making you aware ki what are the types of implants for knee replacement available as of now. So the first slide which you can see, this is something we call it as gold coated in layman language, which as per the latest study says it has more life as compared to the normal COCR. The adjacent to that is COCR. So if you have noticed here, the femur thing and the tibia thing, femur and the tibia thing both are COCR, that means stainless steel, in layman language stainless steel. Over here it is gold plated. The importance of this is gold one has an upper. There is one more implant, oxinium we call it as, which is superior to this, which looks black. The advantage of that is it has more flexibility as well as more life as compared to the gold as well, but it's very costly. Usually we decide what implant to be used based on the age and physiological, not only anatomical age of the patient, physiological age. That means how much patient is active in the life. So depending on that, I think so there are two patients who I can see two patients who have come with a knee replacement. I asked them, what is your age? What is your expectations out of this particular? If the patient is around 70, there is no point in putting the implant of around 4 lakhs unless and until patient asks her to do, because oxinium is very costly as compared to the gold. The one which is approved through ECHS is something the second one.
What is the cost of all this?
It depends whether you are using an Indian implant or a foreign implant. In this particular thing, I could say there is difference of around 40 to 50,000.
Overall cost of
Difference of cost.
Knee replacement you are asking? Through
Replacement in ECHS, the package is there.
yeah.
Admission, procedure, implant, it's about 1,86,000. Almost
Which?
2 lakhs.
Per knee.
Per knee.
One knee, I'm talking about one TKR. Total knee replacement. It's a package.
But there is a limit for us to use the implants. The second one in the ECHS.
So suppose we have to get a good one done through ECHS.
I'll come back to you on that point.
You have to take the difference.
How much will be that?
Roughly around 40 to 50. Roughly around 40 to 50. So the reason of keeping this particular slide is, you can see a metal bar over here. So whenever we do knee replacement, as I discussed, if there is deformity something like this, we try to correct it and we cross check with that particular alignment rod, and then only we put this implant. I've got one model of the implant which is approved through ECHS. This is imported one. Imported one is little costlier. So it looks something like this. Can you just hold it, madam? So how it glides is something like this. So we say that there is particular life expectancy of this particular implant, है ना? आप में से कई लोगों ने जानकारी भी दी होगी या पूछा भी होगा कि डॉक्टर इसका लाइफ कितना होता है इम्प्लांट का. सो द लाइफ ऑफ दिस पर्टिकुलर इम्प्लांट डिपेंड्स ऑन हाउ मच एक्टिविटी यू आर डूइंग, बिकॉज if you can see, this is metal, the below one is metal, but this is something of a plastic kind of thing. So wear and tear of this particular thing, depending on that particular implant which we are using, the life of this implant depends on this plastic component. And the more you are driving a vehicle, उसका लाइफ कम रहेगा. जैसे कि कोई 3 लाख किलोमीटर चला लेता है एक साल में, कोई 10 साल में 3 लाख चलाता है. So it all varies, but if you ask me, roughly it is around 15, roughly 15 years. Oxinium has an upper definitely as compared to the normal things. Next slide, please.
What is the age definition of
TKR.
I have treated TKR. I have done TKR in 40-year age as well. I have done, the oldest patient whom I operated is 84-year-old gentleman, army person only. So age is not the criteria, sir. the physiology, the parameters of the patient, the X-ray findings, the expectation out of this particular surgery is the deciding factor for the implant and for the surgery.
Doctor,
Yeah.
before the operation, you give injections, right? So those injections are very painful
Which injections, madam?
before the operation. So it's before
So
the
you are asking after admission to the hospital?
yes, yes.
We don't give any injections to the knee.
How the operation takes place.
That is anesthesia you are asking. Anesthesia, okay. That we don't give it at the knee, madam. We give it at the back, spine. Caesarean section have kind of, yes, same injection. They do it, some doctors do it under local anesthesia as well. Blocks, we call it as blocks, not knee blocks, like femoral block, adductor block. But I don't prefer that because injection तो लगना ही है, तो अच्छे से करो ना, करना है. Yeah, I usually, I have not done in adductor block or femoral block because we don't know how much time it will last. In between अगर पेन स्टार्ट हो गया ऑपरेशन के तो फिर उनको जीएम में कन्वर्ट करना पड़ता है. जीएम इज जनरल एनेस्थेशिया. Sorry? Duration I wind up in around 1.5 hours complete, skin to skin. Skin to skin I'm talking. Procedure takes, it's not like purchasing vegetables from market. I'm just giving an example. Before we start up the skin incision, there are particular checklist which we follow. In Pace Hospital is an NABH accredited hospital wherein everything has to be documented and we have to follow for certain steps. So this particular surgery, the moment patient comes in, I'll explain now how. Patient gets admitted, patient's first antibiotic dosage, test dose will be given, all questionnaires will be explained, any allergies will be discussed, cardiologist consultation will be done, all blood tests will be done, anesthetist will see, followed by there is some particular questionnaire from orthopedic point of view. We have a pamphlet of that which will be submitted to the patient, that will be filled up. Patient will come to the operation theatre. Before the patient takes to the operation theatre, again anesthetist will cross check. Once the patient is on the operation table, patient will be explained regarding the procedure of the anesthesia. So there are particular checklists, madam, which we follow, and during that it is role of an orthopedician or the surgeon to explain the relatives in an audio video counseling room. We always explain these things to the patient first, relatives. So you can see over here, this is what is alignment rod. It should always point up between first and the second toe. And when we flex it, when we bend the knee joint, it should always match up to the same point. So these are all the cross-checking things which we do before we proceed with the final implantation. We don't fix the final implant directly. We fit a trial first, we do this. And you can see over here, this is a trial implant what I have put over here. To that there is an extension connection and then the rod. Next slide please. Few videos of my patients. Just click one, sir. Just no, back sir. Back.
Enter.
I don't know. I have added this, but I don't know for what reason it is not being clear.
Not be supporting you.
Maybe it is not supporting. I have added a few of the videos of patients whom I have operated and how we make them walk the next day of the surgery. In fact, the person whom I operated, 84-year-old gentleman, he walked same day of the surgery. He is my only patient who walked same day of surgery. And he was an army person. Yeah, correct. Fine. So, I wanted to show few of the videos, but unfortunately I think so there is some technical glitch. I am not able to show it. But there is one patient whom I operated, she is here. I requested at least 5-6 patients, but one is turned out, Madam Raledo Inka, okay, fine. But Madam, she, Shashikala, she got operated for the knee replacement. If she wants to share something. Son, please join her so that she'll be confident. రైట్ సైడ్ చేశారా, రెండు చేశారా మేడం? రైట్ చేశాను కదా. ఎలా ఉంది ఇప్పుడు?
బాగుంది.
Yeah.
Switch on करना, on करना.
Telugu, I think so people understand. Yeah, some of them. Maybe son can talk.
Yeah, she able to walk out and she doesn't sit down.
I'll give this mic. वो off कर दो.
Yeah. She able to operate on first day she didn't walk because she was very scared. On second day she started walking and from there onwards she is walking good and she can able to sit down now because that's suggested by doctor and now she is able to walk properly.
Is it able to sit down and do that?
No.
Yeah.
Only chair. She can't get totally down and she can't hold only
When was the surgery done?
last year May 2nd.
Oh, yeah.
Yeah, CGHS was from second. And she tried, but she didn't. But she was very scared that this operation was also. But now she said that she started walking.
Again, short stature individuals, they walk little delayed, as well as the recovery takes longer time in short stature people. And it is way complicated and difficult as compared to a normal, 6 feet, something like that.
How long that operation will last?
Depends on her. If you take a vehicle, how long that vehicle will last? It all depends on how much you drive. Like that, how much she walks, how much she folds her knee joint, how better she takes care. Roughly, if you ask me, it is something around 10 to 15.
And after that?
Again, we have to change that plastic one.
Then it depends on the type of knee also.
Yeah, many variable factors. Weight management helps, yes. Before the surgery, I always ask patients to decrease weight.
She unable to walk properly and she unable to sit down.
I had those videos with me. I don't know why it is not being played. I'll circulate it among all of you.
When it's telling on me, if she walks around 10 to 15 minutes more, like she's getting severe. Yeah. And there is no stiffness before that. She unable to even not before the operation, she unable to sit down also. If she is trying to sit down, okay, again it will take some time to get up. It will take minimum 20 to 30 minutes. And then the legs become numb. Right now, normally it is 59.
Now, I have the reason of post-operative pain over the knee joint. I'm not saying all my patients are fit. There is one of the patient who is suffering with the knee pain in spite of the knee replacement. The possible reason for that is there is something we call it as please. Thank you, madam. Thank you. So there is something we call it as nerve which supplies to this particular area. We call it as infrapatellar area. That particular nerve sometimes get irritated. That's why we say out of 400, 500, 1 or 2% patients might have some niggling pain over the knee joint. That's the reason I never push anyone for surgery. I want my patient to decide regarding the surgery. Relatives वाले कोई उनके cousins रहेंगे या फिर और कोई भी लड़के रहेंगे या family members रहेंगे, अगर those people they say कि बाबा please get him operated, I won't do it. I make the patient aware the things, explain कि बाबा ये चीजें possibility है, and then I operate. Sir, उस तरह, right? Whoever I have called are ECHS people only. 3-4 didn't turn up for many reasons. Yes. Genuinely, whatever is there, please talk.
So very easy. My sister that TCAP, actually she was more pain and she unable to walk also. So because we approached the first of all very thankful to you because he has given a good suggestion. And moreover, it is annual 3 days. But 18th of December, he did a left leg because it is the 4th grade stage. And on the 21st of same week, the 3 days after 3 days. For the right side is good. So now this is both the legs. It is final 3 days. And very means third day, they started the walking also. That is all right. And moreover, since the body weight also very less, whatever the sir saying, everything because of the more phase. Now she is all right, and she is only thing is unable to sit on the floor.
That is expected because the reason I tell you. Yeah, please let him continue.
Very important is trust partner is here. Leader the patients is very important. Sir. And moreover, the clearly is suggesting the people one who approaching the doctor, Shami sir, and he the first confidence level is very important. Any age groups, then we are really thankful to him, and moreover, we are suggesting the people who are doing some survey for the doctors what they are doing some after that, right teaching a proper way to link this bound the allowed bound and the proper guidance is the most after surgery, whatever the guidance, we are following the same guidance given by the doctor. And once again, we are thankful to you. So organizing such a program to getting some awareness of that thing, help all ages is required. Moreover, I am a yoga teacher also. Basically, we are not aware of that how to take the oxygen, what is the morning length that the morning 3 to 5 between is very important. It is the boost of the oxygen potentially during the period only. So the yoga and this pranayama is very important to getting the sufficient abundance of oxygen. So once we get the abundance of oxygen, moreover we will kill some issues, some reduce the gains and disease. So thank you very much, sir. Once again, I thank you for that.
Thank you. One point which sir didn't mention due to obligation and all. Wife of Madam Sir is still suffering with some amount of fear. He didn't mention, but let me take. No. Yeah.
Actually, some teaching or some which is counter English
Thing. Timid.
and now she is gradually what she has given or doctor is giving some suggestion of the tablets. So gradually it is going down. I think, but he is reading all the scan, this X-ray, and everything is done. But he showed in front of me also there is nothing as. But the left leg it was in the 4th grade stage. And that's why I am convinced the lady, my missus. But she is really sometimes getting more pain. Once we are visited and is given the suggestion. If she is unable to walk in the daily walking, that's why now she started to walk in daily. Some relief is there.
Yeah, thank you. The reason I pointed this is out of, as I discussed, there is one nerve, we call it as infrapatellar nerve, which gets irritated and usually it subsides by giving some medication. But it is rare scenarios. That's the reason I only asked him to come and just discuss this thing. We have one more patient, not hip replacement or knee replacement. She had hip fracture, and I was not aware that sir is one of the voluntary main person of this CGHS center. So casually he approached to Pace Hospital, and then we treated. In middle of the treatment, I got to know that sir is one of your volunteers. So I would request him to share his thoughts.
My wife is 74 years old. She fell down from the
Physiotherapist will.
early hours of the break last month. She fell down and fractured her thigh bone. And immediately I ran up to Pace Hospital. They have sent the ambulance, and within half an hour I could reach the Pace Hospital. After going there, it happened to be a Sunday. Unfortunately, that day I could not meet him. But in emergency, they have suggested her to be on medical management because my wife was taking blood thinners. But 9 o'clock night, he gave me his facts and all, and seeing the patient. I know you are nice. And he suggested we have to take development management for 5 days and the surgery 8 was fixed. During this period, he explained to me the system, how it works, what exactly happened, and what procedure he is going to adapt. And he suggested 2 methods. And he suggested one method which he preferred for his parents. So I said, no, I will go for that. And I don't know whether I should be taking this or not. He carried me. He has taken me. He has done the surgery in front of me. Minimum opening, accurate pinpointing, and very small keyhole surgery. I was thinking I am afraid because of the blood cut. But it was very small cut, insertion, putting through really. I really appreciate and after that, he kept on visiting, treated, after 5th day, he discharged. While coming, while I wanted to take bath. Then immediately what he said? He called for the bandages. He removed that and put that bandage, go for bath. Nothing will happen. And after removal of stitches,
Please, sir. Yeah.
he was kind enough to visit this CGHS and he asked me, where is your house? How far it is from the CGHS? I said 2.5 kilometers. Okay, I will come and remove the stitches. He came to my house and removed. And when he opened that, so was your diabetic and all, nothing was there. Nothing, not a stain of blood. So clean surgeries. And really I appreciate and I suggest Dr. Place Hospital and suggest Dr. Anand for any orthopedic centers.
Thank you, sir. Thank you. So in general, फिजियोथेरेपी का सेशन है सर, 10-15 मिनट्स में वाइंड अप कर देंगे. In general, I know it is. थोड़ा वो कैमरा ऑफ करोगे आप?
Sitting on the chair, then after some time my leg starts paining.
Paining,
Then
yeah.
I have to put it like this.
Correct. Yes.
So what does that mean?
It's an arthritis, man. Definitely arthritis. Yes. आप एक्सरे है यहाँ पे करा लेते हैं आज ही. है ना, अगर एक्सरे है तो एक्सरे करा लेते हैं.
He's suggesting an X-ray.
एक्सरे.
And when do we know that we have to get operated?
It all depends on your X-ray and clinical examination. I don't treat patient symptoms. I don't treat X-rays. I treat patient's psychological status as well as what patient is actually suffering with. There are few instances wherein patient comes with grade 3, grade 4 arthritis, but patient is absolutely walking fine, bending, और रेगुलर एक्टिविटी कर रहा है. क्यों करे भाई सर्जरी? जब पेशेंट का घुटना पूरा फोल्ड हो रहा है तो क्यों करना है? क्योंकि सर्जरी के बाद तो फोल्ड होगा नहीं. Then why should I operate? So there are ifs and buts in every particular disease, but in general अगर आप पूछोगे third and fourth require surgery. Yeah. Oncology, I am not. Yeah, okay. I'll try my best to answer, but I cannot assure.
What are the symptoms of bone cancer?
Yeah, I can answer this. Yes, this is related to bone. Now, bone cancers depends on what symptoms of bone cancer depends on what particular site it is. If you ask me any particular, I'll answer that.
Site?
Bone cancer can happen. Commonly, it is over the spine, over the leg region, over the hip region, pelvis region. Common symptom is pain which is not able to justify in terms of blood test or any other ruling disorders. That is the commonest thing. Pain अगर continuous है which is not subsiding in spite of the highest medication. And if you fall into that category, जैसे कि osteosarcoma है, which happens in the early age group, Paget's disease है, all those multiple myeloma है, all those things happens in the elder age group. So depending on that, the symptoms vary. Spine का अगर है तो पेन होगा, बैठ नहीं पाएंगे, करवट लेते वक्त पेन होगा.
फीवर की हो
फीवर लेट स्टेजेस में होगा मैडम, अर्ली स्टेजेस में नहीं. Yes.
Majority of our folks, they are acting either in golf course or some other sports. What is your advice? How do we manage the injuries of tennis elbow and how?
Just go for strengthening and stretching exercises. So warm up. What is more important, warm up or cool down? Warm up या cool down?
Warm up.
दोनों. Warm up. If you ask me, cool down is more important. Because warm up के बाद में आप तो वैसे ही खेलने जा रहे हो. But आप अगर बॉडी को वापस मसल टोन नॉर्मल नहीं कर रहे हो, then you are going back with injuries at home. To cool down, there is one particular thing which we need to. Can someone help her in arranging the laptop? Yeah. Priya, I have taken much of your time as well. You have to be very precise. Precise. I'll help you out if you want anything. So, what I was telling?
Cool down.
Yeah, cool down. Yes. So cool down is more important than warm up. Definitely you have to warm up before any exercise, but make sure whatever exercise you do in warm up with less intensity, you will do after the game as well.
Once you already had that injury, can it be managed or
Then
it needs
it depends. It depends again. Severity as well as how much you are involved in that particular sport. Can you modify that? All those things. For example, gym trainer को अगर pain हो रहा है तो we'll ask them to stop. But golf को अगर 10 golfers elbow हो रहा है तो फिर then there is no point. So we have our physiotherapist Dr. Priya here. She has prepared few slides just to keep yourself fit at home. If anything is there, Dr. Priya can answer or I can help her out. Yeah.
Physiotherapy is not covered in CGHS.
Yeah, it's.
this called?
You want this?
You have to take crash sections. Procedure will be.
So, good evening everyone. I am Dr. Priya, physiotherapist in Place Hospitals. So, whatever the doctor has discussed, the three main topics that we have seen, one is osteoarthritis that is commonly seen, and osteoporosis, and then followed by sarcopenia. Okay, so these are the three common things that you see when the age is going up. Okay, so in order, these three are degenerative processes that cannot be stopped or completely prevented. So in order to that, we wanted to slow down the process of this degeneration process. Okay, the physiotherapy doctor will be helping you to slow down the process but not completely to stop. Okay, did you get my point? So we are not here to stop it completely, but we will help you to slow down the process. So from these three topics, I have picked few of the exercises that you can do regularly at your home. No matter what, you don't need any of the support from the others, but you can do it for yourself. Okay, and just go through it. So you can just skip this. Yeah, next one. So these are the basic exercises that will help you to do that at your home. Okay, first one is like heel slides. You have to just lie on the bed, just drag your heel backwards and then go forward. So you will be doing each repetitions. We have to do like how many times will I do, ma'am, or how many times a day you will be doing, like how long should I do this? So you will be doing for at least 5 to 10 repetitions initially, twice a day you will be doing. Okay? And then followed by hip abduction. So we have discussed this osteoarthritis, sarcopenia, and osteoporosis. So these three topics, we have seen that it majorly indicates the hip, knee, ankle, small joints, shoulders. So I prepared this slide share to mainly concentrate on all the joints in your body. Okay, so first we will go with the knee, hip, and followed by the other parts. Okay, So you'll be followed by the hip abductions. Just lying on the bed, just move your leg outwards and inwards. Okay, you can just go to the next slide. And this is SLR we call it as, and you will be doing just raising your leg
Milk
up
products.
and holding for at least 5 to 10 seconds initially and then keeping it down. And same thing you will be doing in side lying also. And then followed by hip extension where you will be lying on your stomach and lifting your leg back. Okay? Next slide, please. And this comes to quadriceps, which strengthens your quadriceps muscles, which is your thigh muscles. Okay, you have to place a ball or a rolled towel which is in your home. Just roll it and place it under your knee. Okay, and just press it down. Hold for at least 5 to 10 seconds. Whenever you do it, it's important to hold it. Okay, you have to press it down. Ankle will be pointing towards you. Hold it and then relax. Okay, which helps to strengthen your quadriceps muscles. And then followed by hamstrings. For hamstrings, the same towel, you will be rolling it and keeping it under your ankle. You will be pressing it down, ankle pointing towards you and holding this and then relaxing. Okay, the first one is for the quads, which is your front muscles of the thigh. And hamstrings will be this back of your thighs. Okay, and then you can slide it up to. And we come to the VMOs, and these all for the strengthening purposes. Okay, you can just place the ball or a roll towel between your knees, press, hold, and then relax. And then followed by you will be bending your legs back, hold, just place the ball or a towel between, press, and then hold and relax. And this is short or quad. You can have to place a foam roll or which is higher than a ball. You can just place it under your knee. Just press it down the knee and you have to lift and keep it down. Lift and keep it down. Okay. And the same thing which you are doing in lying position, you will be able to do in sitting also. In sitting, you will be pressing the ball just slightly, just sitting in this position. You can press the ball and try to lift your one leg up and keep it down. And dono ek hi saath, like you can bring both the legs up and you can just bring it down. Okay, and the same thing when you come to this squats or small slide plus VMO, we say it is not more than 45 degrees because we will be teaching these exercises post-operatively and before starting the operation also, and also people who are suffering with the pains. Okay, when you see these conditions, you will be able to know that this is a degenerative process and also you will be having the pain and which you will be not able to do more activities. So in order to reduce all this, we have designed this wall slides plus VMO. Okay, it will be not more than 45, it will be just 45 degrees of squat. You will be pressing the ball and taking it down till 45 degrees. And this is the stretches part which you will be doing in this position. Just place it around your foot and pull it above towards you and hold and then relax. Okay, and then quadriceps stretch you will be doing in standing position and also in the lying position. Okay, this is in the standing position. Just stand and lift your leg back, hold it and hold for 5 to 10 seconds and then relax. And then followed by sit to stand exercises which you can generally do in just normal way. Okay, and then heel rises and toe rises, what support you will be doing. And this comes under balance exercises. Okay, single leg balancing, you have to take support, try to lift one leg and hold and then take it down. Okay, and then followed by, this is with the para band. There will be a band, variation bands that you will be using for strength training. Okay, so in that time, you will be using to strain or like you have to strengthen your muscles. Not support, like generally not doing it, but you have to start strength training. Okay, where you need to build up the muscle mass and as well as the strength in your muscle. So for that, we will be using this Taraban. There will be a different type of resistant bands that are available, but initially prefer like going with a medium resistant band. Okay, and you have to, this is me strengthening with the Taraban, and you have to place it around your ankle and you have to tie it back of a fixed support and you have to lift it in the air and maintain it for at least 5 to 10 seconds and then relax. Okay, that is how you do, and also the same way you can just do it when you try to fixed support. Okay, the same thing you will be doing in front. When you tie it back, you will be lifting your leg up. When you tie it front, you will be folding your leg back. Okay, holding is important whenever you do with this Taraban. Okay, and this is with strengthening with the band that you have done in the lying position, right? You have just moved your leg outside and inside. The same thing, the strength training will be starting with the Taraban in standing position. And this is the extension like knee extension you will be calling, and you have to tie this band around your ankle and you have to take it back. Okay, and followed by we have done with the hip and the knee. Now we are going for the neck part. Okay, the cervical region. So this is the neck range of motion we call it. Just moving your neck up and down towards the sides and bending towards the side. Okay, these are the basic exercises that you can do in your homes. Okay, and then followed by stretches. And stretches we will be doing shoulder rotations you will be doing, shoulder shrugs you will be doing, bending your head towards the opposite side and bending towards the down and bending towards the up. And these are just normal stretches that you can do it for yourself. Okay, and then followed by chin tucks, just grabbing your chin back and towards front. Okay, and same the shoulder shrug and easy that you will be doing, like just placing or taking support against the wall and lifting up and taking it down. Okay, and these are the isometrics. So isometrics you will be doing same with your hand and you will be placing it on your head, forehead and pressing it into the hands. Okay, you will be feeling the resistance from your hands as well as your head. Okay, you will be pressing into your hand, hold and then relax. And the same thing you will be doing towards back also. You have to bend your back and hold it for 10 to 15 seconds and then relax, and the same thing towards the side also. Okay, and we are done with this cervical region. And now coming to this trunk rotation, the lower or lumbar region. And this is first one is hip trunk or hip rotations you will be saying. You have to turn your pelvis to either side and your face will be opposite to it. Okay, you have to hold that position and then relax. And this is single knee to chest, and sidewise you will be taking both knees towards your chest and you will be holding that stretch for at least 5 to 10 seconds and then relax. And next one is cobra stretch. You will be doing on your belly, lifting with the elbow straight and lifting your head up. And this is child pose. You'll be just sleeping on a child like and just sitting back of your heels. Okay, take support like sit on your back of your heels. And then followed by bridging, where you will be lifting your pelvis up and you have to hold it in air and then relax. And this is Superman pose again in tummy lying position. You will be lifting opposite limbs. When you lift your right limb, you will be lifting your lower limb left side. Okay, it is opposite side. And in the same way, you will be lifting both limbs at a time. Okay, upper limb and as well as the lower limb will be lifted at a time. And then coming to this wrist. And these are the wrist stretches that you will be doing. Just pulling apart your arm, holding it for 5 to 10 seconds and then relax. Okay, just take your arm straight and you have to pull it and then relax it. Okay, make sure your elbow is also straight. Okay, you have to pull it and then relax and palm towards up, pull it towards it and relax and towards it down as well. Okay, these are the stretches that you will be doing, and followed by prayer stretch, you will be just dragging it down. Okay, and the same thing, reverse prayer you will be doing it and towards up. Okay, and this is the wrist range of motions that you will be doing initially towards up and towards the down and towards the sides and towards this and towards the body. This one. You can go with the VMS exercises so that it will be helpful for strengthening your
What I usually do is my timings differ daily.
and yeah.
I'll share my number with you all people.
That will
No
be
problem.
helpful in
You can call and
strengthening
come.
your
Yeah, otherwise, my
Okay, and
PRE
then
number is
followed
there.
by finger bends, you will be doing just, you have to just flex your fingers and open it. And then, see, you can just, and these are finger lifts that you can just open and close and lifting your fingers on the surface and abductions and adductions closing and moving apart. And opposition, just doing the small exercises that you can do by sitting itself. Okay, it doesn't take much time to do also. And ball squeezing, just grab a ball all the time, carry along with you, just squeeze it. And finger strengthening with the band you will be doing, which you can find it at your homes. Just tie it around your fingers, open and close. And this will be the weights. Okay, the same range of motion that you are doing, you will be doing with the weights as well. Okay, initially go with the 0.5 and then 1 to 2 kgs, it's enough for you. Okay, and then coming to the last part, the ankle part. Okay, I'm just winding up very fast. And ankle pumps, just moving your ankle up and down. Yeah, that's the sir is doing. You can just move your ankle up and down. Okay, and then followed by toe extensions and flexions. The greater toes that you are having on your leg, you can just close and open. And tokens, you can just use a hanky or else a tissue on the floor and you can just grab it up and you can just relax it. Okay, and then followed by calf stretch, you can place it around your calf, pull it towards you, hold for 10 to 15 seconds and then relax. And this is again with the Taraban, ankle strengthening with the Taraban. You have to tie to a fixed support in front and you have to pull the ankle towards you and hold and relax. And when you are pulling towards you, the Taraban, you have to pull the leg outwards. Okay, and the same thing inward and outward. So all these exercises that can be done to strengthen your muscles, to improve your muscle balance, and also to be more fit enough to do all your daily activities. So its main motto is that you will be doing your own activities without any other support. Okay, when you do it regularly, you will be fit enough, and you will be able to slow down the process that you are going through. Okay, and also along with this, you will be having the Taraban, tape, kind of taping is also done by the physiotherapist, and that tape will give you the support to the joint or the where you're having the pain area. Okay, so that is what we do as a physiotherapist, and I hope you all understood, and thank you so much once again for this opportunity. And I'm so glad Godavari patient with whom I have been as a physiotherapy for them. I'm so glad that she's doing so well. I'm so happy that the sir is also here. Thank you so much, everyone.
Yes, thank you. Yes, thank you.
Basically, he is the corporate manager of Case Hospital, Mr. Venkatesh, a very positive person. Night 1 o'clock, I give him a ring. The ambulance reaches in half an hour. Any part of the city. So that good he is. So anybody having problem, you can take his number. Ambulance will be there. Just ensure the card is functional. The card is not blocked. Okay, ladies and gentlemen, it got a little longer. We had planned it for 2 hours. It went slightly more than that. We planned it from 3 to 5, and I have been planning for the lecture for almost last 1 year. We, Dr. Anand,
Yes, sir.
we have been planning and we thought we do it at RSI, but somehow it did not materialize. Colonel Menon also tried a lot, but somehow it did not materialize. Okay, whatever it is, we somehow managed to have a lecture. I hope everybody has benefited from this lecture. I hope we have. So, on behalf of myself and entire fraternity of veterans, my sincere gratitude to Colonel Dr. Anand.
Thank you. Thank you.
Big round of applause for Dr. Anand.
And
One more secret, apart from his professional discipline, he is the national cricket team member of the national doctors cricket team. He is represented our country. He is He is an excellent sportsman and is a member of the National Doctors Cricket Team. Thank you, sir. Thank you. We are so grateful.
Thank you.
Request you to accept one small comment from our side.
Yeah. No, let me. Yeah, I'll come. No problem. Right.
Thank you so much.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.
Thank you, sir. Thank you. Thank you.
Sir, just one take-home message. Anything particular to orthopedics or in general, reach out to me. I'll help you to the max which I can or base hospital can. Secondly, all these years, you people have served for Indian nationals. So I feel privileged to help you out in your day-to-day activities. So I'll wind up this session by calling Jai Hind. Thank you.